Hello everyone, welcome back to my channel. Today we are going to learn about bone marrow aspiration and examination. In our previous video we saw what is bone marrow, types of bone marrow and functions of bone marrow. In this video we are going to learn about bone marrow aspiration and examination. Okay, let's see what is bone marrow aspiration and bone marrow biopsy. Bone marrow aspiration is a procedure in which a small amount of bone marrow fluid is taken through a needle for examination, and bone marrow biopsy or trifine biopsy is a procedure in which a small amount of bone with the bone marrow will be taken for examination. Now let's see why we need bone marrow examination. Bone marrow examination is essentially done to confirm or rule out a hematologic disorders like leukemia, lymphoma, etc. It also helps in non-hematological disorders like metastasis, to assess marrow cellularity and morphology, to evaluate iron stores, monitor effects of chemotherapy or marrow transplant, to investigate causes of unexplained anemia, thrombocytosis or leukopenia. These are the few conditions in which patient will be advised for a bone marrow examination. Okay, now we'll see how we can get a bone marrow sample. As I stated before, bone marrow may be obtained by two procedures. One is bone marrow aspiration and another one is trifine biopsy or bone marrow biopsy. Here, bone marrow aspiration is a simple, safe procedure, and trifine biopsy or bone marrow biopsy is indicated in conditions where the aspiration either fails to yield marrow or to confirm some of the diseases. Now let's see what are the sites of bone marrow aspiration. The usual sites for bone marrow aspiration are sternum, posterior superior iliac spine, iliac crest, anterior superior iliac spine, spinous process of lumbar vertebra. In infants, upper end of the tibia is considered as an ideal site for marrow aspiration. The major tool of the procedure is the bone marrow needles. It is like a hero of the story. There are three types of bone marrow aspiration needles we use. For aspiration, we use Sala needle and Klima needle, and for biopsy, we use Jamshidi needle. These three are the most commonly used needles. Before entering to the procedure, let's learn about the parts of the bone marrow needle. The first part of bone marrow needle is stellate. It prevents entry of soft tissue and bone fragments into the aspiration needle when it pierces through them. Next, aspiration needle. For aspirating the marrow, a syringe is attached after removing the stellate. The last part is guard. It adjusts the depth of penetration of the aspiration needle. Here you can see the parts of Sala and Klima needle, and here you can see the parts of Jamshidi biopsy needle. In the pic at your left side, it is labeled as A, B and C. A is T-handle Jamshidi needle, B is acquisition cradle and C is ejector tool. The ejector tool is used to eject the bone marrow biopsy sample from the needle. The aspiration procedure of a bone marrow is typically performed by the physician such as hematologist, a specialist in blood disorders, an oncologist, a cancer specialist, or by a trained advanced practice healthcare provider. This procedure is an outpatient procedure and it can be done in a hospital or clinics. It may take hardly 15 to 30 minutes. Let's look into the procedure to be followed to get the bone marrow samples. Firstly, we are going to prepare the patient for the procedure. Explain the patient about the procedure, like for what purpose this procedure is happening and steps involved in the procedure, about the risk of this procedure, and after the procedure what has to be taken care, like post care of the procedure. A written consent has to be taken from the patient after explaining the purpose, steps, risk and post care of the procedure. Patient's medical history has to be reviewed. They might have bleeding disorders, allergies, sometimes especially to local anesthetics they might have allergy, and current medications, for example anticoagulants or any other medications might have been taken. Baseline vitals has to be checked like blood pressure, pulse, temperature, etc. Pre-procedural blood tests like CBC, coagulation profile if necessary. Positioning of the patient for the procedure. If the procedure is going to be done on posterior iliac crest, patient lies in lateral decubitus or prone position. If the procedure is going to be done on sternum, patient lies supine with chest exposed. In this, you can see the patient lying on prone position. The sample is going to be aspirated from posterior iliac crest. The equipments used for the bone marrow aspiration. A sterile tray with bone marrow aspiration needle, for example, Sala or Klima. For bone marrow biopsy, Jamshidi needle will be used. Sterile gloves and drapes, syringes, 10 to 20 ml, local anesthetic, antiseptic solution, scalpel if needed, glass slides, EDTA tube, biopsy container to collect the samples, gauze adhesive bandage. Now let's start the procedure. Clean the area with antiseptic in circular motion from inside out. Drape the area with a sterile drape. Infiltrate the skin, subcutaneous tissue and peristrium with local anesthetic using a fine needle. Wait a few minutes for full anesthesia effect. Okay, now we'll insert the needle. Use the aspiration needle with stellate in place. Advance needle through skin and soft tissue until it contacts bone. Apply steady pressure and twisting motion to enter the marrow cavity. Remove the stellate from the needle. The needle insertion is completed now. Now we are going to aspirate the sample. Attach a sterile syringe to the needle. Aspirate 0.2 to 2 ml of bone marrow fluid. It can cause a sharp pain or pressure for the patient. Quickly place drops of aspirate onto glass slides for smears. Additional fluid may be collected in EDTA tubes or other containers for special tests. For bone marrow biopsy, a larger hollow biopsy needle is used to collect a core of solid marrow tissue from the same or nearby site. The needle is gently twisted and pushed deeper into the bone to obtain the core sample. The core sample is withdrawn in one piece and ejected by an ejaculator and collected in a container, will be sent to the lab for further processing. After collecting the sample, remove the needle and apply firm pressure with sterile gauze for a few minutes to stop the bleeding. Cover with sterile dressing. Observe the patient for any adverse reaction, for example bleeding, dizziness. Advise patient to avoid strenuous activity for 24 hours. Next, label the slides and tubes correctly with patient ID, date and time. Transport promptly to the laboratory for morphology, flow cytometry, cytogenetic studies, for example karyotyping, molecular test as required, example PCR for genetic mutations. For morphology, the slides are stained with Giemsa and Wright stain and examined under the microscope. Risk and complication of the procedure. Pain or discomfort at the site, bleeding or bruising, infection in some rare condition, fainting or allergic reaction. This is also a rare condition. So this was the short note about a bone marrow aspiration and biopsy. If you find my video is useful, please like to this video and subscribe to my channel. Thanks for your support.